Hello, everybody, and welcome to Taylor Tuesday. We are back for another session. It's just me and Ira tonight. Mike King has the night off. Tonight, Ira will be talking about managing biologics, advanced wound care, and successful reimbursement. I am Ashley Watkins. I am with the sales team at Taylor Medical. So we will get into a little bit of, if you would like a replay of tonight's webinar, feel free to check out the website. You can find all of the previous webinars on the website. Webinars is located in the upper right-hand corner, and you can find anything that you are looking for there. I would like to invite all of you who haven't already to check out Taylor Medical's website for a cost analysis. We like to give an apples-to-apples comparison. You will be working with me and the team, Carla and Siobhan. You can actually send us an Excel spreadsheet of what you're currently ordering to admin at Taylor Medical, or you can visit the website, and there's a little cost analysis button on there. We can help you if you just have a list of invoices that you have, or if you have your own Excel spreadsheet that has what you're ordering monthly. We can go back as far as 3 to 6 months, however you would like to do it. I do invite you to do that. We are showing some great savings. I just had a 38% savings the other day on a cost analysis, an aggregate savings. So it is really, really worth it. It is free. There is no cost to you. All you simply have to do is send over an Excel spreadsheet, and you could really, really change your practice. So now I will turn it over to Dr. Ira Kraus, my good friend, my manager, my everything.
Well, thank you very much, Ashley. I just want to add one thing to what Ashley said about Taylor, and I just would suggest that before you purchase anything or do anything, give us a chance. You never know what we might have or how we can help you in any way possible. And we are here to promote and support the profession. We've given $50,000 already in student scholarship money to the Educational Foundation. So the more that we are able to help your practices, the more we're able to help the profession. And I'm going to talk tonight about, managing biologics. And, I think that for those of you who are practicing a lot of wound care, see a lot of critical limb ischemia, limb salvage, you've seen a big change in the opportunities and the tools that we have to work with our patients. I mean, obviously, I think we all know, at least in our space, and I've been telling people for years that I think that as podiatric physicians and surgeons, I think that we are the primary care physician of the lower extremity. And, diabetes, is an epidemic. You can look at the numbers. The statistics are not good. I just recently relocated from Chattanooga, Tennessee to Whitefish, Montana. And for the last 30 years, I've been living in, if you ever look at the map of the demographics on diabetes, I was in one of the bright red states. The Southeast is a very bright red, but every 7 seconds, someone is dying from diabetes. Every 20 seconds, a lower limb is amputated. The lifetime risk of people with diabetes to develop a foot ulcer is 34%. More than 50% of them become infected. Diabetes contributes to approximately 80% of the 120,000 non-traumatic amputations performed in the United States. Diabetic foot ulcers double mortality and heart attack risk while increasing the risk for stroke. The relative 5-year mortality rate after limb amputation is 68%, second only to lung cancer at 86%. So this is a problem. And our goal as physicians and healthcare providers is to try and heal these patients, in my opinion, as quickly as possible. When I started working and I was doing my residency, regular wound care for me was mixing betadine sugar in a denture cup, packing the wound. We were using steel retention sutures at the time, we'd close the wound down, and we'd come by every day with a turkey baster and flush out with saline and repack the wound till either we got to the point where we can either do a secondary closure, or unfortunately the patient needed further amputation. So, I think that our goal is to try and get these wounds closed as quickly as possible. I think if we accomplish that, we'll have a very successful, rewarding practice for ourselves professionally. When we think about it, I'm sure you all know the causes of leg and foot ulcers. We've got poor circulation. We've got venous insufficiency, diabetic neuropathy, hypertension, chronic lymphedema, inflammatory diseases, smoking, and other medical comorbidities. So I think that every time a patient has multiple different comorbidities, they increase the risk of their ulceration, and they also decrease their ability to heal. So I think it's critical that not only do we identify the wound, but we need to identify the cause of the wound and how we're going to treat it. When you think about it, and I've spoken for many, many years on practice management and healthcare, and there's no doubt that we are in a world where we are in the business of medicine. When I started 30 years ago, I didn't think about the business impact or the economic impact of everything that's going on. I do believe that as healthcare providers, it is 100% our role to manage the economic impact. I think there's not a thing that I wouldn't do for any of my patients, but I also want to make sure that my patients are willing to do what it takes, to get better as well. When you think about diabetic foot ulcer patients, they're twice as costly to U.S. Medicare as those with diabetes alone. The cost of diabetic foot ulcers is greater than that of the 5 most commonly forms of cancer. In the United States, a total of $176 billion is spent annually on direct costs for diabetes. As much as 1/3 of that will be spent on lower extremity amputations. $1 million is spent every 30 seconds on diabetic foot complications in the U.S. alone. Among patients with commercial insurance, each dollar invested in care by a podiatrist results in $27 to $51 of savings for the healthcare system. Among Medicare eligible patients, each dollar invested in care by a podiatrist results in $9 to $13 of savings. So obviously, the impact that we have as podiatric physicians and surgeons on these patients that have diabetic foot wounds is critical and undeniably valuable for better outcomes for these patients. When you think about where we are with these patients, and you think about, everyone always says, if you're using any type of in-office DME wound care products or advanced biologics, a lot of people will say, well, that's very, very costly and it's very, very expensive. And when you think about it, when you look at the overall cost of an amputation versus a wound care cost, there's a significant difference. For those of you who remember, and I don't talk politics very often, and I don't mean this to be political, but when President Obama ran for office his first time, he talked about the reimbursement that physicians received for doing a below-knee amputation of $70,000. Obviously, that's the aggregate cost of the amputation and the hospital stay, and had really not to do with the physician reimbursement. But the bottom line is, I think that it's on the radar screen. And how do we prevent amputation? We evaluate these patients appropriately. We do a stepwise, methodical fashion, vascular, neuro, derm, biomechanical, and we make the appropriate recommendations for the patients with regards to wound care. We want to set them up for success and not failure. I think that it is 100% critical for you and your practice to develop a clinical protocol that you're going to follow when you're treating these patients. You're going to have what you consider standard of care. I can tell you that in my practice, 60% of my patients get better with good, aggressive, local wound care. I was a big believer in the utilization of DME products, whether it be collagen powder, collagen sheets, calcium alginates, hydrogels, foams, compression garments, anything that I could use and put in my patients' hands to help them get a good outcome, I did. But there are those patients who are not going to heal with the normal, what we would consider standard of care treatment. And we have to look at implementing the utilization of cellular tissue products or advanced modalities to get our patients better. And I think that at least I have heard for years and years about the challenges that people have in their practices with regards to utilizing advanced cellular tissue products or skin substitutes. You know, obviously, it's an expensive cost of goods, particularly for small practices. And depending on what type of payment terms you have with the vendor, it could be a problem. The insurance reimbursement is continually changing. We've seen, especially with Medicare, some of the Medicare carriers have changed some of their reimbursement policies without any notification. There's the risk of no reimbursement. You know, what type of assurance plan do you have? What protects you in case something happened and you didn't get reimbursement? The prior authorization process is time consuming. I know that with all of the changes that we've had to make in our documentation with regards to MIPS and MACRA, our staff is extremely overwhelmed, and sometimes we feel undermanned. You know, you have all the DME issues, so just having somebody be able to do the prior auths is a problem and is draining on the staff. And a lot of the manufacturers, there's limited relationships. In some cases, the reps are continually changing, and some of the manufacturers have a very good team and very consistent team. But it really depends on your practice, because I think a lot of times, depending on your utilization, is how frequently and often you'll get serviced by some of the reps. As far as the result of what happens, for those people for those clinics that incur these problems or encounter these issues, there's going to be two scenarios. Either you're going to refer the patient out to a wound care center, or you're not going to have the proper tools to help manage your patients. And I will tell you, for me, back in my early days in practice, I believed in collaborative care, and I did refer a lot of my patients out to the wound care centers. Unfortunately, I never got those patients back. And that's really kind of what educated me and taught me about wound care, the importance of wound care, how I wanted to build my practice. And that's really what I developed, was doing wound care critical limb ischemia. And it changed everything for me. It made me happy, both professionally and personally. I think that when you think about some of the typical clinical impediments that I've encountered over the years, and I will tell you that I have many, many, many friends who have been turned upside down, both with skin substitutes and with the durable medical wound care dressings. And a lot of this is 100% based on documentation. I'll talk about that in a little bit, but the reason is that we see is, you know, not being compensated for the services provided. So I can tell you that some of the biggest problems that I've seen is physicians billing the incorrect amount of units. So what happens is, obviously, every cellular tissue product comes in a different size and multiple sizes. And so what happens is, you need to make sure that you're billing the right amount of units. It may not be the physician that billed the wrong units. Sometimes I see that there are issues where billing staff has billed the wrong amount of units. So I think that, you know, it becomes a problem on units billed. Every time you miss billing units, your revenue is decreased. Incorrect products being billed. If you use a lot of products in your office, especially if you keep products on inventory and in stock. I have seen a lot of times where the incorrect Q code is billed. Doesn't mean you don't get reimbursed, but once you kind of do your self-audit or you figure out what's going on, then you need to refund the insurance company and then file for the correct product. The lack of a benefit verification. It may be that you did the benefit verification and unfortunately it didn't get scanned in. It wasn't put in the appropriate location in the chart, now with all the electronic charts. So, I mean, and not having any of these items, all three of these, will definitely cause a problem for compensation, because what happens is if you have a prepayment audit and they ask you for the benefit verification form and you don't have it, it could be a problem. So again, having all of these things and having solutions to these problems is what I think is going to be critical. And I think that's what I'm going to talk to you about on what I believe Total Ancillary offers and provides better than anybody out there at this point right now, in my opinion. You know, there's an extended amount of employee involvement. A lot of people say, well, I don't want to do biologics because it's just too time consuming. It's not worth the bang for the buck. I don't want to do with my patients. You know, you've got invoices that have to be chased down. You've got graft logs that are missing. I mean, there are certain very clear critical requirements that CMS and the private payers are looking for in your chart, not just your documentation. Very similar to like when we do DME wound care products and you have a prescription and you have a letter of medical necessity and you have a dispensation note. When you're doing advanced cellular tissue products or biologics, you need to have invoices and graft logs so that you can check everything that's going on. Lack of physician understanding the financial impact. So, you know, it's very interesting. When you do wound care in your office, if you see a patient that you're going to debride, you're getting paid for the debridement regardless of what you do. And there's really no cost factor other than your traditional overhead, you know, staff, you know, office expenses. But when you're looking at the biologics, there is an opportunity where I think you can provide amazing, above standard care and also understand the financial implications. So not only are you helping the health of your practice, but the health of your patient, but you're helping the health of your practice. So one of the things that Total Ancillary does, and we'll talk about it later, is they're going to give you a financial impact analysis of grafts or cellular tissue products that are covered by the payers in your area, both Medicare, Medicare Advantage, and private payers. Okay, another big problem is tying the invoices to the patients. We get invoices from these companies on a regular basis. Whether you get them daily, whether you get them weekly, whether you get them monthly, you're going to get invoices. Many times these invoices don't have a patient name. They just have an invoice number. So if you go back to your graft log and you haven't tied the graft number to the patient, you may not be able to tie these invoices as they come in because you don't know who they go to. And then there's also the issue with workflow for documentation review. I would suggest that anybody that is doing advanced cellular tissue products as well as in-office DME wound care, that the charts are reviewed by a different set of eyes even before they go out the door to the insurance company. Because once these claims go out, if you get a denial, you know, now with all of the electronic timestamping and things that are going on, you really don't want to edit or change the notes after you get a denial or when you get a letter for a prepayment audit. So you know what happens is it's crazy to think about everything that you have to do, and it is very, very time consuming. So that's why I think if you have the right tools, it makes this much more successful and easier to use. So I'm going to talk a little bit about Total Ancillary, one of Taylor Medical's vendor partners. And I really think that they've taken the opportunity to develop a system that helps make this manageable and makes it much easier for your staff, much more accountability, and it helps put you in a position to financially stay on top of things. Almost everything that I did in my practice, whether it was DME, diabetic shoes, we used software. There's a lot of tools, and I think you have to find the right tool. And when it comes to wound care, I think Total Ancillary has everything together. I remember when I was applying to colleges, I don't want to tell you how long ago because it'll really date me, but we had something called a common application. And we could fill it out and apply for 20 colleges on one application. It was very, very easy, very simple. We do that with Total Ancillary. There's one insurance verification form. You can fill out of the products that you're interested in, that you think you might want to use. I will also tell you from my perspective, as when I was practicing in the clinic, when my patients came in with a wound, I wanted to be prepared to do anything that I wanted to on the patient. So I actually sent in my benefit verification as part of my clinical protocol when the patient walked in the office with a wound. It doesn't hurt anything. It doesn't use up any of the visits that the patients potentially have. It doesn't count as a graft. What it does is it actually gives you the information in advance so that if and when you decide that you want to go to a advanced cellular tissue product or a skin graft, whatever your acronym is that you like to use, you already know that. So it's already done and available. I may see a patient, obviously certain products require conservative care, certain insurance companies require conservative care. So this way, by sending in that form on day one, it'll come back to you and let you know, yes, it's okay to use this. No, it's not okay to use this. And you actually have it on a portal if you really want to be looking at everything. So, Total Ancillary, what they do is based on where your practice is located demographically, they will look at the Medicare carriers, Medicare Advantage carriers, and the private payers, and they will identify those products which you've selected. But they also may select some additional ones to let you know the benefits of utilizing a different product. And I think when we go back to talking about the business of medicine, I think the first thing is always patients first. It's all about the patient. And I believe that if you do the right thing for the patient, then everything else is going to fall into place. So if you know that you want to do advanced cellular tissue products for these patients, and you've made that decision, that's going to be the best thing for the patient. And I guess the next question is, what's the best thing for the practice? If you have 3 products that you are comfortable with, that you feel provide good clinical outcomes, and one has a net margin of $25, one has a net margin of $150, and one has a net margin of $600. For the health of your practice, I would obviously utilize the product that has a $600 margin. It also, when there's better margins, it helps when the patients don't have secondaries or their secondaries don't cover. But at least you have the ability with the information, because you're going to get a summary page. And it's really going to be non-biased from the standpoint that it's going to list products that you have requested, that you use, that you're comfortable with, as well as giving you additional choices that maybe you weren't familiar with. Maybe you did not know that XYZ product reimbursed with your carrier. So I think that it gives you the ability to make a medical decision, tie it in with a financial decision, so that you're having full transparency in your practice. Doctor places the order, and then Total Ancillary executes. They generate a PO, they place the order, they work on the shipping logistics, they keep the receipts, they keep the graft, they check the graft log, they have support. It's really been amazing, because I will tell you that my practice currently uses the portal, and the portal is great because it's live data. We do a data dump, but what's even better is because, you know, a lot of the vendors, I don't want to say all, will send multiple invoices. They may send it via mail, they may send it via email, they may send it, well, I was going to say fax, but I don't think anybody faxes these days anymore. But you get it multiple times, and a lot of times these invoices get duplicated. They get scanned into your accounts payable system, and your accounts payable is overinflated. So I think that there's a lot of things. So the fact that there is now a ability to track everything, I will tell you that once a month we run an analysis on all of our biologics, and we find anywhere between, because we have multiple clinics, I would say anywhere between 15 to 20 products that actually the vendor billed us the inappropriate amount for. So there are checks and balances in all aspects of everything that you're doing when you're doing utilizing the Total Ancillary platform. I mean, it really has, at least from my perspective, addressed and revolutionized all of the areas where people had impediments. The ordering was taken care of, understanding the payers, having the ability to have multiple manufacturers, but have somebody act as your intermediary, decreasing the workload for your staff, education, there's training and customer service. You minimize the risk. Total Ancillary a lot of times has extended payment terms that are significantly better than some of the individual vendors. They are working on running regular reports to see how you're doing, to see what's not been billed. We actually, it's a great check and balance system. It's great for cash flow, because as small businesses, we all have to keep the lights on, pay the bills, pay the staff. And if we are not getting paid on these extremely expensive products, it affects cash flow. Patients, you can keep the patients in the clinic. You don't have to send them out, other than the fact that they may need vascular intervention or infectious disease consultation. As far as the actual care of the patient goes, you now have the ability to utilize the tools that are needed and not struggle or not have the difficulty or fears that many of our colleagues have had with reimbursement and tracking. And, you know, from a revenue perspective, as I said before, there are products that the reimbursement is a moving target. I think that you should all be comfortable and know every product that's in your toolbox that you want to use. There are some tried and true products that have been around for a long time. There are new products that are coming out all the time. And I think that it behooves you as a practitioner to not educate yourself on all the products. I can tell you that any of the products that you need educational material on, if Total Ancillary were to send you a benefit verification form and there was a product on there that you didn't recognize, they can give you the educational material so that you're not left blind and have no idea what product you're dealing with. The platform is been phenomenal. It's ever evolving. You as a clinic can look on the portal, and if you have a patient that you verified for 5 different products, it will list which products the benefit verification has come back on, which ones are still pending. You could look at your purchase order information. You could look at your invoice status. You know, we look at it from the standpoint of, I make it really simple. I look at it as four categories. I look at it as something that I either want to hold, something that's good to pay, something that is in appeal or denial, and something that is paid already. So I can look at those are the four categories I look at when I'm looking to see what's going on. From a billing perspective, you can track the insurance claim reimbursements and tie them to invoices. So that way you actually can see what your net margin is on each patient that you're providing care on. And then accounting. You can tie this into your accounts payable. You can know when to process the manufacturer payment by tracking the claims. Obviously, it's associated with the invoice number, so everything is identical. I have found personally in the past that a lot of times our accounts get screwed up because what happens is, let's say you get a credit from a product that either was not covered and the company gave you credit, or you sent the product back. A lot of times the refund just gets applied to an account, and believe it or not, it's not, as you and I would think intuitively, applied to the actual product that was ordered. It's actually just applied to the account. So in theory, you can get a invoice from a company that has a open invoice on a patient, and that patient actually never even got anything because you did get a credit, but that credit was applied to another patient. I can tell you that I've spent many hours reviewing and looking at payment reports because that exact problem happened. Well, it doesn't happen with the TA software platform, because that platform, we find those things in advance and we review it regularly. And I think if you assign somebody into practice who is going to work regularly with the Total Ancillary team, you can make sure that everything is buttoned up with any product that you're using. One of the things that we did in our practice, which worked really, really well, a lot of times when you want to return a product or do something, you would give it to the rep. Well, if it goes to the rep and there's no email trail or no paper trail or no following of the process, sometimes those grafts get lost. Yes, I said lost because that happens. I think what we've done and what we implemented is if a vendor doesn't get a PO generated from Total Ancillary, we don't pay those POs. So it's that, because that's our policy and procedure. So if a company goes to the doctor and the rep brings a graft in and says, "Hey, Dr. Krause, try this. It's really good. It's a new product. Medicare covers it." And I broke the chain of command, and it was initiated by the company. we actually, it's not reimbursed, because it didn't go through the proper channel. There's, actionable analytics. I don't know how many of you look at your practices and actually look at what you're doing. Okay, if you're looking at key KPIs, key performance indicators, you want to look at different things. I actually ran wound care as a separate division, so it was definitely something that I have looked at and become very involved with analytics. So you could have real-time dispositions on all orders. You could link wound care claims to invoices. You can monitor the profitability of the claims and invoices. You can analyze graft reimbursement per payer. So if you don't know what your fee schedule is, and you've been submitting claims for product XYZ to insurance company PDQ, you're going to see what that number is. You're going to know what your reimbursement is. You can evaluate the graft reimbursement per product. I know that, I can tell you that there were certain products that I knew had a higher reimbursement with some vendors, and and there were some products that were only covered by certain vendors. I practiced in Chattanooga, Tennessee for almost 30 years, and we were one of the first states in the country to have managed Medicaid. And I can tell you that we definitely struggled in finding the right products that we could provide for the patients. Once we got that dialed in, it made things a lot easier. I mean, back in the day, I had many claims that weren't paid because the vendor told me it was going to be paid and it wasn't. Invoice payment review and the denial tracker. I think the denial tracker is key because it's been set up. It does require input from the staff to put notes in, but it saves the time of having to keep going and generating reports in your EMR. You can put all your denials in the tracker. You have a place to put all of your comments and discussions and things that are happening. And it allows you to follow what's going on, whether it's at reconsideration, first level appeal, second level appeal, whether you're working with the actual, whether you're working with Total Ancillary's revenue cycle department or the revenue cycle department of a particular vendor. But you can put all your notes in one place, and the denial tracker has been an invaluable tool. And again, they continue to be improved. The Total Ancillary has a full team of programmers that are always changing things. If it's within reason, I know people have had special adjustments made for their portal for things they want to see. So I think that it will produce actionable analytics, but it also is a flexible IT team that is willing to make this work for you. So we talked about the universal insurance verification request. It's pretty simple and pretty straightforward. We've put the majority of the diagnosis codes here. We have the length of the wound that's here. So we are putting all the information that is required and necessary for you to get your benefit verification for the different products. And like I said, you can put multiple products on one form. I know this is going to sound really strange. We started doing this before. For those of you who do biologics, if you do a benefit verification, normally it's going to tell you this is good for 5 applications, this is good for 8 applications, this is good for 10 applications. What happens if the patient changes their insurance in the middle of your treatment plan? What we've done in practice and what I recommend that people do if they're utilizing the Total Ancillary platform is I would actually do a reorder form every time you do a graft. So that way, in case the patient's insurance changed, we catch that. Because I will tell you that I'm not going to tell you that it happens a lot, but it's not uncommon for patients to change insurance plan during the course of a treatment, particularly if you have a patient that possibly towards the end of the year and may have been in the process of changing carriers for the new year or getting a different Medicare Advantage plan. And every plan is different. Not everybody covers the same products. So if you started putting in using one product for a patient and they changed insurances and you didn't know that, you could potentially be hung out to dry. So utilizing the universal reorder form, I think, is very important. This is what the sample summary page looks like. It gives you your name, the patient information, patient ID, the date of the procedure, the product that's submitted, gives you product A, product B, product C, tells you if the primary and secondary is covered. It gives you any comments of anything that's required medical necessity-wise. And it gives you the reimbursement, the cost and the margin per product. And there are products that have smaller sizes that have a negative margin. So again, understanding the financial implication and impact with your practice is critical, particularly if you want to continue providing this type of care to your patients. I think it's really, really important that you understand the financial backing, the financial portion behind it. So the Total Ancillary solution is medical decision-making, business transparency, equalizing optimized incomes. It's really not any simpler than that. I think that there is time involved in setting things up. I think you can set it up to your level of involvement that you want. We have many providers that don't use the platform and just use the company for the products. But I think if you really want to be successful in what you're doing, bringing the right tools in is going to be critical for making sure that your practice is healthy. I know that your patients are going to be healthy if you're doing the right thing, but we want to make sure your practice stays healthy so that you can continue providing care to those patients. The platform supports many product lines, skin substitutes, flowables, DME wound care dispensing. So basically, this platform could be used for anything that you're doing in the wound care or musculoskeletal space that requires skin substitutes, flowables, or wound care products. Everything could be managed through the portal. I am going to end it at 20 to 6, and I'm going to wait for Vanna White to come back on. And Ashley, that's you, Vanna White. Yeah. And I just want to let everybody know that if you want to, please visit Total Ancillary's website, www.totalancillary.com, and submit a web form to schedule a presentation from the Total Ancillary sales team. I can tell you on a personal note, if you would like to know anything about any of the different products and you want to reach out to me, you can reach out to me through Total Ancillary as well, or through Taylor Medical. We are here to help you, and Total Ancillary is definitely one of the companies that I think is critical and getting everything done.
Thank you so much, Dr. Kraus. We've got a few questions. So one of the questions is putting the names on invoices going to be a HIPAA violation?
No, because what happens is if you when you work with Total Ancillary, you probably are going to sign a BAA, because if you're doing, and especially if you're going to be faxing and transmitting patient demographics and patient information, even for the benefit verification and benefit authorization, then you should be, then you would have a BAA signed with that company, which then would cover you. So there really isn't a, and I'm sorry, that there's a, when you ask for by the way, when you ask about putting names on the invoices be a HIPAA violation, in theory, you probably have a BAA with any company that you're doing work with. So whether it's the manufacturer itself who actually generates the invoices, or whether it's Total Ancillary and their benefits verification and platform that they use, you'd have a BAA. The problem is it's not that it's just not done frequently. When we get the invoices from the vendors, many of them just give them their own number. Every one of the companies that I'm familiar with all have their own numerical ID number that they apply to each graft, and that is on the sticker. So that sticker matches the graft, and there is no name associated with it. So a lot of times this information gets confused. The wrong sticker gets put under the wrong patient's name. So it is a problem, and I think that it's definitely something that this process helps resolve. And, you know, I can tell you that what we did at our clinic, because we had about 50 clinics, we actually developed an online digital graft log through SharePoint. So I think that you could be creative in a lot of things that you do, and then you have this online active graft log that your billers and coders can access. If you determine that there's any issues or problems, you know, we catch them very, very quickly because we have everything put there. So no, it would not be a HIPAA violation as long as you have the appropriate form signed. Now, if you don't have a BAA with a vendor or anybody that you're working with, then yes, it would be a violation.
Yeah, I think that I was going to touch on that too. I think working in the office and doing it all, having that log is so imperative to be able to look back on for several different things, and having some sort of system like that, it makes it so much easier for the staff. And I think too, you know, coming from somebody who was filling out the BVs and things like that, that is something else that for the staff that Total Ancillary provides that makes it so much easier. And the staff isn't spending a huge amount of time of their day at the end of the day filling out all these BVs for different companies. And I really think Total Ancillary has done a great job when it comes to that. I will give you another question here. And I know that denials is going to be a big question that doctors are going to have. You know, doctors have been burned in the past with denials on the wound care. how does TA help to prevent, how does Total Ancillary help to prevent and solve that problem in the future?
Well, as far as, the denials go, the first thing is making sure that we have the benefit verification before the product is even ordered. Many times clinics will order the product without having the benefit verification. So, and when the benefit verification is done, that's where you find out some products and some plans require a prior authorization, which is completely different than a benefit verification. So if the benefits are verified and it's verified that the particular insurance carrier wants prior authorization, then the prior authorization is completed. So by getting those two steps done, that's what's going to be needed for the claim when it goes out. Now, there are other things that need to be done. Depending on where you practice, there are different modifiers that need to be put on the claims, whether you're wasting a product, whether how much you're applying to the product. So those things are all different, and they educate you on that. They educate you on the billing for your Medicare Max, your Medicare Advantage, and your private payers to the best of their ability. Okay, and so that's how I think it helps it. I want to take one step back, Ashley. In our clinic, when we switched to the Total Ancillary platform, we used to have not just a graft log, but we would have a shipping log. When did it come in? When did it go out? We had a million logs. We had a million, at the time, Excel spreadsheets. We don't have any of that now. The only reason, because everything is in the Total Ancillary platform, which, by the way, if you're a Total Ancillary user, there's no charge for the platform. So you can have access. You just have to put in the time to get trained. You have to do it in service with their team, get onboarded on how to utilize the platform, but you don't need to have multiple spreadsheets, because what happens is online you go into the platform and you can see what benefit verification is done, what benefit verification is pending, when the product was ordered, when it was delivered, and when the date of service was. And what happens is Total Ancillary, we go over these reports weekly. We identify, for example, what happens in your practice when a patient is scheduled for a application of a product and the weather is bad and they have to call and cancel, but they come in the next day? What I've seen a lot of times is when the product came in, they put the graft log in on the wrong date of service because the patient now changed their date of service, and a lot of the records don't match up. So it really depends how well you set up your own clinical protocols and procedures and integrate the tools that are available for you to use. I mean, tools are just what they are. They're tools. You have to use them. Just because they exist, if you're not using them properly, they're not going to benefit anything that you do. So I will tell you that for me, without a doubt, it's made things significantly easier and easier to manage. I can tell you that it helped me turn around a division of our company that was not doing as well to being extremely profitable. Again, medical care and patient care, it's not we're not even questioning that. This is the business part of it. And I believe I already said it, but Total Ancillary does not charge for the utilization of the software if you are doing your ordering through Total Ancillary with the products.
Okay, can you tell everybody what kind of terms that Total Ancillary provides?
So, that's very interesting. I think it varies. Sometimes Total Ancillary, so Total Ancillary is an agnostic company. They do have agreements with some of the vendors and not all of the vendors. So if they have relationships with the vendors and they can get extended payment terms, you benefit from that. If you start using the if you need to use the actual credit terms or terms of the actual manufacturer, there may be no changes. But for the most of the time, Total Ancillary has been able to negotiate some extended terms, and they work with you on making sure that your claims are going out in a timely manner. So hopefully you don't even reach the time where you need to start making payments. I see a question that says software ? So this is an online platform that Total Ancillary has. It's a Total Ancillary wound care portal, and you can call Total Ancillary and you can have a demonstration done. They'll show you exactly how the portal works. Depending on your EMR system, they can either build an HLA-7 interface, which automatically gets everything live. In our actual clinic, we do a data dump once a week. So we know that we're always a week behind in the data, but we get a data dump every Monday, and then the portal gets updated every Monday from the payment side, not from the daily stuff that goes on where the benefit verification forms are being put on the portal. Those are done daily and are live. Any of the products that are being ordered, all of that stuff is all daily live. The only thing that is a week behind on data, because that's the way we choose to do it, is when the payments are coming in and posted and when the claims are going out. So other than that, it's all live on the air.
And does Total Ancillary provide any billing support when it comes to, maybe helping the staff on what to bill?
Yes. They have a revenue cycle management team that is familiar with the majority of the insurance payers. They're familiar with the MUEs. You need to be very comfortable with the medical unnecessary edits, which means how many units you can bill. That's another problem that we've seen, is that people put on products that are larger than what the insurance company will allow. So they help you with that. They help you in, there are some products that are what's called non-ASP, which means they don't have a published price by Medicare, and they may require you to submit it with an invoice. They'll educate you if that's the process for that particular product. We actually, in our practice, we submit all of our non-ASP products right through like Palmetto has a direct portal, and we could put everything that's needed and bill the claims right through the portal, not through the EMR, and the claims get paid significantly quicker. So, those are things that are really, really helpful. I see a question here, and Ashley, maybe we can take this gentleman's name, and the question is, are you able to link with Greenway Intergy? I can't answer that. We would have to get with Total Ancillary. What I can tell you is if you wanted to have an HLA-7 interface, I'm fairly sure that they could do it. But if not, it's very easy to do a data dump. So, but I think, Ashley, if you can take that down, can we get back to Dr. Moore?
Absolutely. Absolutely. I think that's all the questions. I think to sum it up, I think it's imperative for your staff to be trained on this platform as well as the doctor. I think that is the key here. Patient care and getting these patients what they need, and also, making your staff confident in filling these things out and helping with the process and getting on the platform. That's really, really, really important.
I would agree. I think that everyone has their own SOP, standing operating procedures, right. And I think that it's very, very important that whatever you do, you be consistent. I think that's how we get good outcomes, because we're consistent. And when I say good outcomes, I mean good outcomes for our patients and good outcomes for our practices. Remember, I'm the first to tell you, you got to pay the bills. You have staff, you have supplies, you have rent, you have advertising, utilities, and you have to make decisions that are going to be both beneficial to the patient and to the practice.
Absolutely. Do you want to talk a little bit about the next Taylor Tuesday?
I would love for you to talk about the next Taylor Tuesday.
Okay, guys. So the next Taylor Tuesday is going to be July 6th. Same time, same place. And this is going to be hosted by ReadyThotics. If you guys are not familiar with ReadyThotics, they're an over-the-counter orthotics. Great. We used them in the office. Mike Friedman is with ReadyThotics. He's great. I wish you guys would come on and learn a little bit more about that. I know some of you are not even dispensing over-the-counter orthotics in your practice, and I really think that you should. I think patients love them. That is something that people come back over and over and over for. And I thank everybody for coming on tonight. I know that you guys maybe miss dinner or leave your family for whatever time zone you're in. So we really do appreciate that everybody jumps on here with us and has, since this crazy pandemic and everything's opening up again. Congratulations, California, you guys, and New York, you guys are back to normal living. And I hope that you guys join us again. Yes, Dr. Moore, all of the webinars are recorded for you to watch later on taylormedical.com. And don't forget, everybody, if you want that cost analysis, reach out to me. If you need some other DME to go along with your wound care, reach out to me. I'll do everything I can to help you get some savings going on in your practice.
I think that Ashley summed it up. We've worked together for the last 17 years, and if it can be done, she's going to do it, and we're going to do it. We have a great team with Siobhan and Carla. I'm just a pretty face in the background. They're the bosses. But in all reality, anything that you need for your practice, whether it's treatment chairs, medical equipment, believe it or not, we are saving people a ton of money on credit card processing. We are saving a ton of people money on our office supplies through Staples. Please, anything that you think about using in your practice, Taylor has the ability to offer you a savings and give you a good quality comparable product. So anyway, as Ashley said, I want to echo thank you to everybody for joining us tonight. I know that you take time away from your families. I know that you take time away from your friends and time away from yourself, because I know that you all work hard during the day, and usually the evenings are the time for you to relax. So we're thankful and grateful that you've joined us. I see many familiar names and many familiar faces, and hopefully we'll start seeing you live at some of the meetings soon. If anybody is here going to the South Carolina meeting, please go to the Taylor booth and say hello to Ashley, and she'll be more than happy to walk you through anything live and in person. Absolutely. So I want to tell everybody to have a great evening. Ashley, thank you for being a great hostess. And see you all next week. In 2 weeks, sorry.
2 weeks.
Bye.
Bye.